Hello everyone, cause and effect of drugs. I thought that is a very important factor which we missed in our coaching program so far. That's why I want to add this little slideshow for you. In your health coaching clinic, you will encounter clients who are taking prescription medications. And I know it's not in your scope of practice to advise clients whether or not they should be taking pharmaceuticals. That's really in the hand of the doctor. But you are entitled to explain cause and effect of drugs. We know nothing goes into the body without a consequence. It doesn't matter if it's good, bad, or both. A reaction we put in has a reaction. And one of the most prescribed prescription drugs are proton pump inhibitors. They are sold like worldwide for over 13.6 billion in 2009. They are used to decrease the production of stomach acid to help prevent heartburn or GERD, the gastroesophageal reflux disease. Babies who vomit up their milk are put on proton pump inhibitors. This solves not the problem of the vomiting up, because a lot of babies do that and it's probably a normal thing, and babies cry too. What GP think that it solves the problem of stressed mothers. And that is really from my own experience. Actually, my son worked in a pharmacy for a while and he said he was shocked how many prescriptions go out every day for babies on proton pump inhibitors. The common names of proton pump inhibitors are Prilosec, Prevacid, Nexium, Protonix, and at least another 40 other brand name and pharmaceuticals, depending on the country you live in. Is it really likely that you will encounter a client on a PPI in your practice? Do I need to know the pathophysiology of every drug? No. But when your client's health is being compromised by something, then it would be good to take note. What do proton pump inhibitor actually do? It sounds a little bit complicated, but look. Proton pump inhibitors suppress gastric acid secretion by inhibiting the hydrogen potassium ATPase enzyme system at the secretory surface of the gastric parietal cells. Okay, let's go back and see what does this mean. Gastric acid is a digestive fluid naturally formed in the stomach. Gastric acid is composed of hydrochloric acid, which is potassium chloride and sodium chloride. Gastric acid is critical for the proper digestion of proteins. We know that. It stimulates digestive enzymes which break down the long chains of proteins into their building blocks, amino acids, something we really need. Secretion is a key function of digestion where different fluids are introduced at different phases to induce the chemical processing of the food we eat. Hydrogen potassium ATPase is an enzyme that initiates the action of the protein that acts as a proton pump to release the gastric acid. So parietal cells are the cells within the stomach's tissue lining. So if we sum that up now, this means that there are substances produced in your stomach lining which are meant to help break down food, our stomach acid. It is very, very important. So what they actually do now, the protein inhibitors, they inhibit the gastric acid release. What are the problems and side effects of inhibiting an essential digestive function? They are big because they are at risk of B12 deficiencies. B12 utilization requires a healthy and not compromised stomach lining. Iron deficiency, additional nutrient depletion including folate, calcium, magnesium and zinc with longer term of use. Increased potential for food allergy or sensitivity because the poor body has to process food that hasn't been fully broken down. Fatigue and low energy. Now, there are more risks to come. There's high risk of Clostridium infections in patients using PPI because the gastric acid seems to be protecting against this infection. There's a potential adverse relationship between PPI use and community-acquired pneumonia. There are small intestinal bacterial overgrowth, a condition that is associated with bloating, diarrhea and malabsorption. Recently has been associated with PPI use. Increased risk of osteoporosis, related fractures of the hip. Patients taking PPIs for long periods of time showed an increased risk of heart attacks. And there's possible side effects of the use of PPI are headache, diarrhea, constipation, abdominal pain, flatulence, nausea, and rash. What are the other common drugs which are prescribed? One of the other one are statins, cholesterol lowering drugs. Everyone over 60 is mainly under statins. That's more or less what GPs say. You are over 60, you have to get statins. Known under the name of Crestor, Zocor, Lipitor, Simvastatin, Avicor, Lescor, Simvador, and prescribed, as I said, nearly to everyone who's over the age of 60 and younger. Okay, the statin drugs, danger. Because, first of all, they deplete the body of vitamin QQ10, most vital thing for your heart and energy. They interfere with biological systems, including an early step in the mevalonate pathway, which is the pathway for steroid management. Negatively affected are all sex hormones, cortisol, cholesterol, and vitamin D. So the side effects of statin drugs are muscle problems, polyneuropathy, like that's the nerve damage in the hands and feet, and rhabdomyolisis, a serious degenerative muscle tissue condition, acidosis, immune depression, pancreas or liver dysfunction, including a potential increase in liver enzymes, anemia, sexual dysfunction, cataracts, memory loss, increasing risk of diabetes. And they are really serious. So my dad myself was on statin drugs for a few years, and the first thing which came up were the muscle problems. So he was very weak, he couldn't walk anymore, it's just like very, very weak and tired muscles. And then came the problem with memory loss. So luckily he listened to me after a while, and he stopped taking the statin drugs. And his doctor, should not only listen to his daughter, and then everything came back. So his muscle improved, memory was fine, he was clear in his mind and not cloudy anymore. Oral contraceptive pill, the next one. Over approximately 12 million women in the USA take them daily to prevent pregnancy. It's not only prescribed to prevent pregnancy, it is provided to regulation of menstrual periods, irregular periods, dysmenorrhea, endometriosis, PMS syndrome, acne, already kids from 11 years old, alopecia, hair loss, decreasing the risk of CIS, pelvic inflammatory disease. Does they help? Well, the side effects of the pill are huge. They have intermenstrual spotting, nausea, breast tenderness, increased breast cancer, blood clots, high blood pressure, increased arterial plaque, miscarriages, migraines and headaches, cramps and yeast overgrowth, gallbladder disease, weight gain, mood changes, depression, missed periods, decreased libido, vaginal discharge, visual changes with contact lenses. If you think about it, how often women actually take them for many, many years. Nutrition depletion of oral contraceptives are the biggest problem. The World Health Organization points out that the influence of nutrient depletion caused by being on oral contraceptives is a great cause for concern and should be of a high clinical relevance. I don't think that a lot of doctors think about that. So oral contraceptives may affect levels of folic acid, vitamins B1, B2, B6, B12, vitamin C and E, and the minerals magnesium, selenium and zinc. They also can decrease levels of the antioxidant QQ10 and the amino acid tyrosine. So what that means is hormones radically affect zinc. So zinc deficiencies causes ovulation and sex hormone production to be impaired. It also affects the sexual desire and fertility. Vitamin B12, vitamin E and vitamin C are lowered when taking OCPs, up to 30%. Lower level of selenium, magnesium. The absorption of copper is increased, disrupting the zinc and copper balance. We know high copper is actually an increased risk for breast cancer. Higher levels of vitamin K may lead to blood clot formation. Reduction of the amino acid tyrosine, which is needed for the functioning of a healthy thyroid gland. I know it's not our job as a truly heal coach to take our clients off their medication, and you're not allowed to. but it is our job to help them understand how to welcome, initiate better health. So the ability to connect the dots and support their transformation is in your hands. Just says the little picture: educate, inspire, and empower. So what you do is you investigate what types of medication are being taken by your client. Quite important, because very often they take so much because every doctor prescribes him something else, and not every doctor checks all medications they take, and quite often the patients are not even telling every doctor what they are taking. Then identify the possible side effects of the drug, symptoms, deficiencies, whole body impact. I know that could be a very tedious work, but it definitely will pay off for the client. And then educate. Make your patient aware of the drug implications, empowering your client to talk with the health practitioner about the necessity of the drug and its possible impact on their health. Is it really important to take all of them? Can they reduce one? Is it possible to even drop them? Okay, as again, is important. You are never ever recommend a client to stop taking their prescription drugs without consulting a qualified health practitioner. It's just too dangerous. But it is in your power to educate them and make them aware that their problems could probably be part of the prescription drugs and their side effects.